How is catatonia diagnosed in autism? Have you ever wondered how medical professionals identify catatonia in individuals with autism? It's a complex process that requires careful observation and understanding of behavior. Catatonia can occur alongside Autism Spectrum Disorder, also known as ASD, and it presents unique challenges for diagnosis. First, clinicians look for a distinct set of symptoms that show a marked change from a person's usual behavior. This is important because some symptoms of catatonia can overlap with typical autism traits. For example, motor abnormalities such as stupor, where a person may not move at all, or catalepsy, where they maintain a specific posture, are key signs. Additionally, a marked reduction in speech, known as mutism, or repetitive movements can also indicate catatonia. Clinicians will observe if there is extreme resistance to instructions or movement, which is referred to as extreme negativism. These symptoms must representing a significant departure from the individual's previous level of functioning. Next, professionals will pay close attention to any noticeable behavioral changes. This includes looking for declines in movement and motor control, such as increased slowness or freezing. They will also assess the person's motivation to act and their activity levels, which can fluctuate between immobility and excessive, purposeless activity. Changes in speech abilities, including reduced communication, are also critical to note. To support their observations, clinicians often use standardized assessment tools designed specifically for catatonia. One common tool is the Bush-Francis Catatonia Rating Scale, which helps quantify the presence and severity of catatonic symptoms. Another diagnostic aid is the lorazepam challenge test. In this test, a benzodiazepine is administered, and if the catatonic symptoms temporarily improve, it supports the diagnosis of catatonia. It is essential to differentiate catatonia from typical autism symptoms. Clinicians look for symptoms that are new, worsening, or qualitatively different from the individual's baseline autism traits. For instance, if a person suddenly struggles with tasks they previously mastered, it may indicate catatonia rather than typical autism behavior. Lastly, diagnosing catatonia requires clinicians who have experience with both autism and catatonia. The overlapping features can complicate recognition, making early identification critical for providing appropriate treatment. In summary, diagnosing catatonia in autism involves recognizing a combination of motor, speech, and behavioral changes that show a clear decline from the individual's usual functioning. This process relies on clinical observation, standardized assessments, and responses to treatment trials. Awareness of these signs is essential for timely diagnosis and intervention.